Hey, and welcome to the ISSP podcast. My name is Roy Collins,
And I'm Somta Obi.
and this is our space for conversations around the intersection between mental health and sports. The ISSP stands for the International Society for Sports Psychiatry, which is the governing organization for sports psychiatrists, in addition to being really a central educational resources for mental health providers who are interested in treating athletes.
As mental health becomes more and more of a discussed topic in sports, we thought it would be a good idea to facilitate these conversations. One, first, so that we ourselves can learn from knowledgeable leaders in the field, and then two, to share this knowledge with you guys. These experiences with the audience, so we could become informed together. Our aims are for this to be a casual experience that's worthwhile and to destigmatize mental health in sports.
And with that, we'll introduce our first ever guest of the podcast, Dr. Dan Begel, who's thought to be one of the originators of this field in general of sports psychiatry. He's going to provide us the really cool historical narrative of where the discipline originated. All righty.
Yes, I'm Somta Obi, a psychiatry resident, and I would like to introduce Dr. Dan Begel. Dr. Dan Begel earned his undergraduate degree and medical degree at Yale. He also completed his residency there, and also he played football at Yale football team. Dr. Dan Begel is a pioneer in sports psychiatry, founding the International Society for Sports Psychiatry, and was also a major contributor for the first textbook in sports psychiatry. Dr. Begel is also the author of one of the Athlete's Creed, an affirmation that is used for young athletes, and you probably used it. I know we used something of that form when I played sports. He's also written many articles about issues that define sports psychiatry. He's also guided clinicians in how to navigate for consulting position in teams. He's also the team psychiatrist for the Los Angeles Clippers currently. Thank you, Dr. Dan Begel, and we're very interested to hear more about your journey through this field.
Yeah, thank you so much, Dr. Begel. It's really an honor and a pleasure to talk to you as the originator of sports psychiatry. We really want to just kind of get a very general background into, what kind of originated you into this field and what it was like kind of getting things started and originally.
Well, let me begin by saying the first sports psychiatrist of record actually practiced about 2,700 years ago. In the Odyssey, there's the story of Odysseus coming home from his travails and throwing the discus, having a wonderful time in kind of their sports festival, but returning to some kind of state of grief and tears. And King Alcinaeus, who didn't actually have a medical degree, particularly at the time, said, according to Homer, tell us what secret sorrow makes you weep. And that's the first time that we know of someone inviting an athlete to talk about what's going on inside of his heart. I think that's probably the core of sports psychiatry now that it's become a field to this day.
Awesome. Thank you so much.
As a formal discipline, should I go on? As a formal discipline, sports psychology had a head start on sports psychiatry. Coleman Griffith studying blind and sighted golfers at University of Illinois, I think in Champaign-Urbana, found that naturally when they were learning to play golf and they were blindfolded, they didn't do as well as the people who could see the ball. But after the blindfolds were removed, those who learned to swing a club blindfolded did better, which he interpreted as forming a mental image. So it was kind of an experimental validation of the psychological role in athletic performance, at least in a cognitive sense. And then people like Bruce Ogilvie um, began to study sort of the various kinds of problems that athletes had and delved more into um, their fears, their sorrows, their ambitions, their anxieties, things like that. The first psychiatrist to write about sports psychiatry was Arnold Beiser. And he wrote a book called The Madness of Sports. I think it was published in 1956. And it was basically 6 case studies, 5 of whom were retired athletes. And still at that time, psychiatry and he in particular came out of a psychodynamic perspective. So he studied and described the dynamics, if you will, the emotional dynamics from which people were both suffering and also transcending their suffering. Could note that both Beiser and Ogilvie were athletic people. Beiser in particular was nationally ranked tennis player at a time when the distinction between professional and amateur tennis was not what it is today. And he subsequently contracted polio on his way to basic training in the Korean War. Didn't get to basic training. He turned his car around, headed back to Southern California. He was a Southern California guy, surfer, blah, 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 active. And by the time he got back to LA, he was ready for an iron lung, where he spent a year with pulmonary assistance. And he subsequently he had done a surgical internship prior to this, and then he switched to psychiatry because he had no use of or almost no use of his limbs, and wrote about that experience, and then wrote about athletes, and eventually was instrumental in establishing the public health delivery system for mental health in Los Angeles. He basically started it. So there's always been in sports psychiatry an empathic quality, an instinct to understand what's going on in the heart of folks in the athletic community.
Well, thank you for that really detailed historical narrative of sort of how we came to this place. You mentioned something that I think a lot of people will have as far as a hiccup when trying to understand exactly what sports psychiatry is, and saying that sports psychology sort of got a head start. So from your perspective, how can one differentiate between sports psychology and sports psychiatry?
Well, broadly speaking, sports psychiatry our mission is to be the guardian of mental health in the athletic community. Mm-hmm. And it's that clinical instinct, if you will, that led me in that direction. For me, sport psychiatry may be almost a calling. And I say that because my mother saved, photographs from when we were growing up, and we used to have these block parties where I grew up, where we'd have games and so forth, and people would also have little booths where they'd sell stuff. And there's a picture of myself at age 9 next to my little booth, and it was the sign was, "Get help with your golf game, 5 cents." And I don't know what kind of help I would have provided at that point. But it was a bit of a calling. And my interest in it also grew out of a clinical experience. You know how those of us in psychiatry, when we think about what led us to psychiatry, there's often a backstory. The backstory has to do with something either we suffered or something someone in our family suffered. And in my own case, the first time I saw a psychiatrist was my sophomore year at Yale. And I had been doing both track, pole vaulting, and football. And I injured myself, a questionable injury, but nevertheless real to me, in track. And it ended my track and field career. And was quite despondent at the time. And I thought that's what I was primarily despondent about. I had certainly a lot of other stuff going on. But so I had an intake at the DUH, and there was a bit of a waiting list. It was spring. So by the time my intake appointment came, I was feeling better. But I remember telling the German, little kind of rotund, very with kind of sparkling eyes psychiatrist who later became a colleague of mine, Issa Ehrlich. I was telling the story, and I was telling the story. I described how my father had also blown out a knee his sophomore year in college, and that ended his football career. And she said, "You don't think that your father's history has anything to do with what happened to you, do you?" I said, "No, no, no way. It couldn't have had anything to do with it at all." But it started me thinking, eventually about kind of what's going on inside. And finally, this is a long way around to answering your question, Roy, but kind of the last question too.
No problem. Take your time, sir.
Okay. But finally, what happened in my case was that I hung out my shingle in New Haven after medical school. And as you know, New Haven is like loaded with psychiatrists, and good ones, affiliated with the university, blah, blah, blah. It's not that big a town. So little me, fresh out of residency, kind of didn't stand a chance. And I turned to one of my mentors, said, "What do you suggest?" And he said, "Specialize in something." And that kind of fell into my lap because I had seen athletes periodically because I had played football there and people thought there was some connection, blah, blah, blah. So that's how I became a specialist. And initially, as you can gather, for me, the psycho, the biopsychosocial was very central to my thinking. And so I naturally paid a lot of attention to what the sport psychologists were doing. Eventually, though, it became clear that there was sports psychology was an amalgam of clinical stuff and a lot of behavioral performance related techniques that may or may not have been attendant to the mental health of the athlete. And so I began, and those of us who were interested in it early on, and I'd include people like Ira Glick, Steve Moffick, a number of other folks, were very interested in the mental health, broadly speaking, including performance-related stuff, but also personal issues, family issues, social issues. So really, sports psychiatry, the mission is to be the guardian of mental health in the athletic community. I don't think sports psychology would define itself quite that way.
I'm really glad you touched on that too. I'm wondering if you can tell us, kind of generally speaking, what are some common diagnoses that you treat or diagnose in the sports capacity context?
Well, every clinical diagnosis under the sun can also afflict an athlete.
Mhm.
So just within the last year alone, I've treated things from a mild ADD to a very dramatic bipolar episode.
Hmm. Hmm.
But there's an area also of, when you say diagnosis, there's an area of sports related
Hmm.
symptoms
Mhm.
we also treat, and those can be defined: choking or acute performance anxiety, slump, prolonged performance failure, uh, behavioral problems within the team, conflicts with teammates and coaches, prima donna syndrome, so to speak. Uh, Dealing with injury, not just dealing with injury, but perhaps looking sometimes at a tendency toward injury or something that contributes to injury. And last, training dilemmas of various kinds, whether to find new coaches, whether to change teams, how to deal, whether it's time for retirement, how to approach training methods, a lot of whether to change sports or change specialties in some ways. There are a lot of training issues that come up that just need to be thought through. And going back to um, Homer, it helps an athlete just to be able to voice these concerns and talk about
Hmm.
these concerns with
Mhm.
other than someone who has no interest in it, someone other than a coach, other than a parent, someone has interest but is disinterested, so to speak, has nothing to gain personally or professionally.
Mhm.
All of
Mhm.
those things, all of those performance related issues, including the training dilemmas themselves, which are kind of the mildest form, uh,
Mhm.
are an aspect of promoting, engendering good mental health within
Mhm.
the athletic community.
Awesome. Awesome.
Right, yeah, I think those are some great examples um, of how you know you've been able to help your patients. Also, just from your perspective, it seems that you had a background in athletics. What are other interests or traits that you see in other sports psychiatrists, or things that you've seen that have kind of directed people towards the field of sports psychiatry?
Yeah.
Certainly, experience and interest in sports is one. And when we're talking about listening to an athlete, that experience is relevant because it helps you ask the right questions, even though no two situations are exactly alike. By having some idea of what athletic training is about, what the athletic experience is about, um, it's helpful to have that. Again, I'm going to come back to it, Somto, but I just want to add something to our role. There is a lot of overlap between sports psychology and sports psychiatry in certain ways. Sure, sports psychiatrists prescribe medication, and we'll get to that. But we, I, and others do use a variety of uh, mental skills training methods in our work. So whether it's mindfulness or meditation or imaging, we may use that when we're addressing performance issues. However, it's a little bit more tailored to the person's kind of inner life, if you will. So we take the kind of history we usually take in psychiatry, we really get into the details, and that helps us shape what kind of meditation thoughts we have. It helps us shape what kind of sort of, if you use DBT, what kind of uh, behavioral principles you're going to help the person focus on, rather than just using generic principles. So there is a fair amount of overlap. I don't know that there's any particular profile for people who are interested in sports psychiatry.
Mm.
Just experience in sports and an interest in psychiatry apparently is not enough. There's a guy who was a few years ahead of me at Yale. I forget his name. It might be Steve Clark. I'm not sure. Who was an Olympic swimmer. And he eventually, I think, became a psychoanalyst, if I'm not mistaken.
Pretty good.
And I may have the name, I may be mixing him up with someone else. But years ago, I tried to get this person interested in sports psychiatry. He wouldn't hear of it. He wouldn't have anything to do with it. Wasn't interested in it. And then there are other people who don't have much experience in sports per se, have more of a experience with just exercise. They're active, but find sports appealing somehow. I think we have to be very cautious of that's a great question, Somto. We have to be careful of what draws us to sports psychiatry. There's something very seductive about the athletic enterprise.
Mm-hmm. Definitely. Dr. Begel, you mentioned something that I want to kind of speak about a little bit more, and it's going to be fairly broad. So don't feel free to not have give us a full breakdown. But when you mentioned medications, I think our viewers and listeners would be interested in sort of broadly thinking about ways in which medications, from their efficacy to kind of side effect profile, different ways in which you have to really take sports into context and athletics into context when you're thinking about prescribing someone psych meds.
Well, you absolutely have to take it into consideration. I was very concerned about prescribing olanzapine for someone in the midst of the season to help them deal with their bipolar episode. So not, the weight gain needs to be monitored, but also the sedating effect. So I spent a fair amount of time working with and talking with the coaches. What are your specific observations in practice of this person? What kind of drills do you have where their attention has to change suddenly? Are they doing it effectively? Blah, blah, blah. So you really have to get into that. I think, there are folks in ISSP who know much more about that than I do, but I think that there's no, and there are certain claims made. For example, one thing we were looking at recently, someone made the claim that Zoloft was a better SSRI to prescribe because there was less of a tendency than some other SSRIs to cause QTC prolongation. Now we look for that. We look for that. I couldn't find it, and I mean, and the students I was with who were more adept than I was could not find that, and also could not find um, any information about one SSRI versus another in exercise.
Hmm.
So that you need to, first of all, be cautious of factoids. You know, if you have 2 or 3 factoids in a row, pretty soon you have some misinformation.
Definitely, definitely, definitely.
So you really need to be cautious about that. So the prescribing um, practices in sports uh, depend upon experience, also the experience of folks who have more experience with particular drugs. I turn all the time to people and ask them about prescribing practices in sports to folks who know more than I do and have more experience about it. Let me just say one last thing about that.
Sure.
Somto, it's sad to say that sports-specific psychopharmacologic research is minimal.
Hmm.
There are so many studies that can be done and need to be done measuring athletic components of performance, cardiac output, reaction time, visual acuity, a wide variety, agility, just simple agility. And these studies are very, very easy to do. For some reason, they have not been done, and I hope you guys do some of them. There is
Yeah.
a fair amount of research in Europe, actually.
Okay.
A little bit more research there that we can rely on, but there's a ton of research on psychopharmacologic effects on athletic performance that
Yeah, that it's unknown almost. And I think that kind of transitions to a great topic that me and Roy discussed about where the future of sports psychiatry can go. So that would be the next question, where the future of sports psychiatry can go, and then also maybe elaborating more on things that fellow audience members can start looking at or working on to push the field forward.
Mm-hmm. Mm-hmm.
Thank you. In addition to what we just chatted about, research on psychopharmacology in sports, the whole area of research um, could use some revision and some upgrading. You know, sports are they're kind of a floating, perpetual experiment of nature.
Hmm.
Things that happen in sports all the time that are measurable. How they're very measurable. The context is the same across a variety of situations. Let me give you a couple of examples. One would be, of course, concussion. Now,
Mm-hmm.
I'm hoping that someone will will compare folks who suffered concussion from folks who suffer some other kind of uh, career interrupting or season interrupting event.
Mm-hmm. Mm-hmm.
Distinguish what is due to brain effect and what is due to just the uh, general trauma, if you will,
Mm-hmm.
of an injury. There's been a little bit of work done on that in Canada, and I know people are thinking about it, but there's a lot more to do in that area. And it has wider implications for psychiatry because how often do we say, oh, this person had a brain injury at age 10? Is that why he or she has a psychotic disorder to say? Today, it's not at all clear. It needs to be kind of studied, and sports are a good way to study it. A second area is the whole area of resilience. How is it that some people recover from a trauma and others don't? And in sports, every week there are thousands of micro traumas because some team wins and some team that really, really wants to win lose.
Yeah.
Some athletes win and some athletes lose. And what happens in that situation? And it's a field where you can actually measure recovery. What's the person's time next time? What's their performance? How many shots, free throws do they make? What's the score? How many double faults, et cetera, et cetera. That's so objective. So the whole phenomenon of resilience, and I think there's a wider interest in resilience. The other last area, I think, Somto and Roy, that we really need to look at is the impact of racism on the mental health of the athletic community.
Definitely.
It's fairly, it's more and more easy to measure racism. The more people look at it, they find, disparities in criminal justice system, disparities in hiring, disparities in salaries, a wide variety of ways to measure it. And of course, in sports, disparities in racial makeup of coaching staffs and so forth and so on. And this goes back to the work of Richard Lapchick, who measured the salaries, compared the salaries of pitchers with their ERAs and on the basis of what their race was, and found distinctions. To measure the impact, what we'd really like to know is the psychological impact of racism on an athlete. What is and that, again, sports is a great place to study that. Just compare find some way to measure mental health or mental well-being. There are a lot of ways to do that. And then see what happens to the Black athletes at a institution that may have a history of some fairly severe racist behaviors, and compare it with the athletes at an HBCU. You have different contexts. They're very, very similar fields, if you will, but there's a variable built into it, and there's a way to measure it. So, I think that's a really important area for us to pay attention to, sports psychiatry, for a variety of reasons. Impact.
Most definitely.
Yeah.
Thank you. Yeah, I think that's a great couple, a few ways that we could start working already. And so hopefully a bunch of us could start working towards some of these great ideas and making some solutions.
Thanks, Somto.
And thank you, Dr. Begel, for all of the words of wisdom and future directions. I think Somto and I definitely agree, and want to be part of that change and research into those upcoming fields. We want to be cognizant of time. We thank you for giving us all the time. Was there anything else that you wanted to make sure that you got out and said on this introductory podcast into sports psychiatry?
Well, can I share a pet peeve?
You certainly can.
This is so trivial. Sports psychiatry used to be called sports psychiatry. Now it's sometimes called sports psychiatry, plural.
Mm,
And I don't really know of a branch of medicine where that's the case. Consultation and liaison psychiatry, it's not consultations and liaisons psychiatry. You know,
that's a good point.
orthopedic medicine is not orthopedics. So I really hope you guys reverse that trend.
Well, we can certainly be part of that sports psychiatry from now and here evermore.
Great, thanks a lot. And thank you so much for the invitation. I know you guys have incredible schedules, probably worse than what I had even as a resident, but so I really appreciate it. And you know, with folks like yourself, the field of sport psychiatry is in good hands. So thanks for inviting me today.
So again, we thank you so much for your time, and we hope to have you again soon with more topics, and we can dive more into the history or present, whatever you want to talk about. Welcome anytime again on the program.
All right, take care.
Thank you. Take care.
Thank you so much for watching or listening to our content today. Please like and subscribe to our YouTube and podcast channels and share this episode with your friends and colleagues. Also, follow us at Sports Psych ISSP on Twitter and Instagram, or you can find us on Facebook as the International Society for Sports Psychiatry. Are you a medical student, psychiatry resident, fellow in a psychiatry subspecialty fellowship program, or a psychiatrist who has completed a psychiatry residency program interested in learning more about sports psychiatry? Join us and become a member of the ISSP. We have a free open source certificate of additional training in sports psychiatry program. For more information about our certification program, membership, or other inquiries, go to our website at sportspsychiatry.org.